We have, we have public comments on matters not on the agenda. We have no members here in the public, from the public, so we will continue and get past that one. Next item is approval of the February 12th, 2024 meeting minutes. Has everybody had a chance to read those?
Yes.
Yeah.
Okay.
And
Any questions?
none.
Any questions?
No?
Okay. Do I hear a motion to second the minutes?
Sure. I'll make a
Okay.
motion to approve.
Okay. Do I hear a second on
Second.
approval? Okay. All in favor, say aye.
Aye.
Aye. All opposed? Minutes pass. Okay, I'll put that over here. Okay, item number 4 is approval, item number 5, approval of the De Pere Health Department policies and procedures.
Yes, so this is my understanding, this is an annual thing. The staff and I have reviewed all of our policies and procedures. The only change, other than minor changes, the only content change was a new policy on interns, just developing a process for signing agreements, bringing it to Board of Health and or Finance and then City Council for approval for any agreements that we would entertain with any colleges, universities for internship
Okay.
rotation. So that's the only new content, procedure, policy. But other than that, it's all status quo.
Do you have any new interns coming, or do you usually?
Yes, we have some new ones.
Okay.
We have a master's student will be coming from Colorado State University, and we will have an intern from is it Concordia, I believe?
Yes, I think it is Concordia, what I read.
Good.
So it's nice to have 2 interns starting here, and they're starting in May, I think, aren't
Yeah,
they?
right.
End of May, and be here
For
till
the
August, if I
summer?
understand.
Oh, okay.
Right.
So,
So yes, that was the only policy change for that new policy, but they've all been reviewed and revised. And again, thanks to the city, our staff in the health department, they helped with that. Everyone took their assigned policies and procedures, and we reviewed them all.
okay. Now, Krista, are those interns, are those paid positions?
One is paid
One is paid.
for the first time,
Okay.
and that's paid with grant money.
And which one would that be?
That would be the undergraduate student.
Okay, from Concordia?
Right.
Okay.
Yeah.
From the environmental health working
Yes.
with Trista?
Yes.
Okay.
Yes.
So over on the right, the column that says reviewed, revised, and there are some that say March 25th, March 26th. Those are the ones that you reviewed.
Right. Yeah. All the ones with the 2024 revised date, those were all the ones we reviewed or revised. So again, the revisions in content were only that new one. Otherwise, it was just minor revisions, grammatical changes, things like that. So the content had remained in all the old policies.
Was a medical advisor involved in any of the reviews on things that she'd be involved with?
That's a great question. Yes, I did email the new medical advisor any of the things that she would need signature for. And so she did review those to
Okay.
give us that authority to work independently as nurses.
So the ones that say immunizations, anything change on those?
No, the immunizations, the state actually drafts those policies, and so we have those as standing orders, and that's what Dr. Chandel, right? I'm still learning.
Yes, Shandell, Cassie Shandell.
Cassie, that's what she has authorized.
Okay.
Right.
Thank you.
Somebody popped up. Oh, let's see. Caller 1. We do have a caller 1. It might be Teresa.
It is. It's me. Can you hear me?
Good. I'm glad you let me know you're online now.
Yes, I tried to log in on the computer, but it kicks me out. So I thought, well, try on the phone. So
Okay. Well, thank you for joining us, Terry. You are in Madison today, I think,
Yeah.
right? Yes. Okay,
I am.
we need an approval on the policies and procedures, so can I have a motion to approve the policies and procedures?
So move.
So moved, I hear a second.
Second.
Okay, any discussion? All in favor say aye.
Aye.
Aye. Any opposed? Okay,
Aye.
motion passes. Presentation of the De Pere City Health Department Annual Report.
Yes, and I did invite Sarah to be here with us. She did co-create this annual report with me, and then of course we had Kelly making it beautiful, like she always does with formatting and picture alignment and things. So Sarah is here with us. If you do have any questions about the activities that have been highlighted here, since I was not here and she and Kelly were, please go ahead and ask. I would just highlight, the biggest change I think is in the formatting. We did want to, get information to the people with some narrative, but we really wanted to put a lot of images and infographics just to make it pleasing for the reader. And so you will see that. Also, one of the bigger changes is instead of utilizing the essential services document, we did move towards the Public Health Accrediting Board documentation with foundational services. And so that is our recommendation that we switch over to that language. The state's doing that, other counties and cities are doing that, and so you'll see that language embedded in here. So
Can you give
again,
us an
foundational.
example of that?
Yeah, so
Like,
on page, let's get there and I'll highlight it. On page foundational public health services, so packet page 23,
okay.
you'll see communicable disease control is one of those foundational public health services,
Okay.
chronic disease and injury prevention, environmental health, maternal child health, and access to and linkage with healthcare. So a lot of our referral resource connections within our community falls under that foundational capability. So within each of those broad headings, you will see then, what sort of activities we do within. So immunizations, animal bites, things like that all fall under communicable disease prevention and control. So although the headings are quite broad, you'll still see a lot of the same activities. It's just organized in a different way.
Okay.
I'm going to say I've read a lot of annual reports in my life, and this is really a fun one to read. I mean, it's colorful, it's concise,
Yeah.
it's clear.
Graphic.
Kelly, you did
I
a
agree
fantastic
100%, Dennis.
Yeah, thank
I
you, Terry.
agree. Yeah.
You did a nice job with your portion. Crystal, you did. Sarah, I understand you put a lot of work into this thing as well, but it was actually enjoyable to read, and because wasn't nitty gritty stuff, but it was very understandable.
Good.
So I think you have something.
Hey, thank you. Very reader friendly.
I agree, and I enjoyed the content. Sometimes they're boring, but this one was actually very interesting.
And it's attractive besides that, you know.
Thank you. Yeah, that's great, obviously.
Yeah.
Put a lot of work into the presentation.
Terry or Sarah, you're going to say something?
No, I agree. I think it was beautifully done. The content is great. The formatting is great. It's just visually very pleasing, and it was a pleasure to read. You guys worked hard on this. Thank you.
So we have a consensus on that.
Good,
Okay.
thank you. Well, the intent
Yeah.
has been received then, so good.
Thank
Yes.
you.
Thank you, Sarah.
Thank you very much.
Yes.
Sarah, thank you. I know she also really enjoyed working on this, and it is good to see the final product. So if there aren't any questions for Sarah, I did tell her that she could hop off after this.
Well, let's make the motion to accept
I
the,
had one question. Wait, hold on, Dennis, sorry.
Yes.
Sorry, I've always got a question. On the part where it says access and linkage to care, and it's talking about the stay-at-home assistance program and the MIH home for COVID and stroke program, and it said that you got 38 program referrals and there were 8 completed home visits. What happened to the other 30 referrals?
Yes, that's a great question. A lot of times, even though referrals come in, the residents do not, it's a voluntary program, and they do not want us to come in, which is totally understandable, and we respect that.
Sure.
Yeah, so it is a voluntary program, and that's why you see that difference in those numbers.
That would probably be worthwhile noting in future reports, just so it doesn't look like you guys just didn't do what you got a referral and just it indicated that consumer declined or whatever.
Oh, sure. Good point. Thank you.
And the other, I guess there's something I had highlighted in it too. It says a new health assessment process will be conducted in 2024.
Right.
So you've got that to look forward to. And what is that going to consist of?
Right. So actually, we had our first meeting today, and we do that in combination with Brown County Health Department,
Okay.
and also Oneida Nation. So we had a meeting today to talk about the data that's going to be presented, and then how to choose priorities and develop a community health improvement plan for this next cycle. And again, the intent of our meeting today was to strategize how we are going to align it with the state health plan, because we do see power and value in that. And so that was the intent of the meeting. We hope to have the community health needs assessment and health improvement plan, that's a mouthful, completed by the end of the calendar year.
And that will be a Brown County Health Needs Assessment Plan, not
Correct.
of the Pere City or.
Correct.
Okay.
Correct. And since I was here last time, that is how we've done it in the past. There are some health departments, county health departments in the Fox Valley, that are actually doing a joint effort because they all share a health system. And so you will start to see that alignment even with counties bordering each other in a more regional approach to the community health needs assessment and health improvement planning process. So it's all about what health systems you share and how closely you work together.
Okay. Well, let's make a motion to approve the annual report as written. Do I have a motion to do so?
I so move.
So moved. Do I have a second?
I so move.
Okay, Terry, thank you. And a second?
Second.
Second?
Sure.
Any discussion? Any additional discussion?
I just wanted to add that I know I've used some of the programs, the mental health and the grapevine, and I really appreciate that you do those, and I think they're really helpful for the community, so thank you.
Oh, good. Thank you.
Yeah,
Pamela,
Sarah was
thank you.
just out, and she did a great job, so.
Yep.
So all in favor of
Thank you.
the report as written, say aye.
Aye.
Aye. Any opposed?
Aye.
Was that opposed?
Aye.
Okay, motion passes.
Thank you, everyone.
Thank you, and nice job, I say, on this.
Thank you, Sarah.
Yep.
Thank you, Sarah, and
You're welcome. Have a great night.
you also, Sarah, thank you.
Thank you.
Okay. Next item, number 7, consideration and possible action on information sharing agreement with the Food and Drug Administration.
Yes. So the DAC-CAP representatives that came and did our agent health department review recommended having this agreement in place so that in the event of a foodborne illness investigation, when there's information that needs to be shared from them to us, mostly, is that we have this agreement in place so they're allowed to share with us that consumer information about potential food products that have been contaminated. So a lot of the local health departments are being encouraged by DATCAP to get this signed. And so when we had that review, they asked us our progress on that, and I told them that I was bringing it to the Board of Health tonight for
Okay.
review.
Now, DATCAP, did they also go to the non-agent health departments, or is this just for agent health departments as well?
To
Only.
my knowledge, it's just the agent health departments.
Okay. And the reason for this is sharing of information?
Yep, that commercial information, documents, anything that they've received for any nationwide investigation for any contaminated
Yeah.
food products.
Is there currently a relationship with the FDA at all now? I mean,
If there is, it would only be through the state.
okay.
So this allows that communication
To go
to go directly with
directly?
the locals who are agents.
Now, it sounds like there's I can't say secrecy, but basically you don't advertise it, but a lot of this stuff probably ends up in the news sometime in the future. So you just get a heads up about it prior to it being addressed on the news media, I would
Right.
guess, in most cases.
Right. And I think it will just assist as we navigate any complaints or illnesses that are being reported individually to the health department. If we had that information, I think the whole intent is that connections will be made quicker, so that releases to the public can be, secured.
Any questions about this agreement? I take it our attorneys and the peer have looked at this and
Yes.
checked it over. I started reading it and I started sleeping right away with it, so.
Yes.
But it looks like everybody's got their signatures with it or names and everything else like that, so.
And with any agreement, it does need to go on to council. So if that could be part of your motion, if you're entertaining that motion, it would have to move on to council for approval.
So with that in mind, then, I guess we would have a motion to accept in concept this sharing agreement between the Pere City Health Department and FDA, and also also with the approval of the City Council as well, or the finalization with the City Council.
Yep.
Is that a motion? Does
I'll
that
make a
sound okay?
motion.
Yep,
Okay, you have a second on that then?
I'll second.
Any other discussion? All in favor, say aye.
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 Opposed? Okay, the motion passes for it to go to the city council as it is written, and see if there's any conversation about it there.
Yes.
There's no negative, no downside to this.
No, it just seems like it's the first time I've ever heard FDA wanting to share information.
Right. And
You know,
they seem to be
It's a good
extremely careful about
yeah, I said it doesn't happen too much,
Non-compete
Terry,
and
so. Yeah.
trademarks and the circuits, like secrets,
Right.
things like that. It's like, yeah, okay.
You be inside information right now. I was about ready to add my name to that list as well, thinking maybe I should know about it as well, so we had something going on, but I said, no, I don't really want to. Okay, item number 8, consideration and possible approval of the Wisconsin DPH contract number 62109 in the amount of $12,509.
Right, so in the memo, you can see that the state is awarding us an additional $300 for a contract we already have. And so that's a part of the immunization consolidated contract. And then at the same time, the Communicable Disease Control and Prevention Consolidated Contract timeframe is now that it needs to renew. So even though it starts in July of 2024, they're getting the contracts out now. So that is in the amount of $3,570. So I did have to include the money that we currently have for the immunization program, and so that is in the amount of $8,939, equaling the $12,509.
Okay, so this is really 2 grants that you receive, one being immunization, one being the one for prevention, and
Yep.
you're getting an additional $300, but they're on a different cycle.
Right.
than the prevention one is, but you're consolidating them so that
Yes.
it all adds up to the $3,570.
Yep.
Okay,
Yeah. And then this has to go on to city council.
city council as well. Okay, do I hear a motion to accept $300 plus the prevention block grant dollars?
I'll make a motion to approve.
Motion, a second?
And send to council.
Discussion about, any additional discussion about this? Terry, you okay?
I second it.
Okay.
Yeah, I'm doing fine. Thanks,
Okay,
Dennis.
your second then, okay. Any discussion, all in favor of,
Just one,
Yes,
one,
go-
one
Doctor?
question I just had was, will that $300 allow you to do anything different than you are already, or?
Yeah, probably not. I mean, the nice thing about the immunization grant is that we can purchase medical supplies with that grant. So it will allow us, to purchase additional gloves or alcohol wipes or things that we need for the immunization clinic. So every little bit helps, I suppose.
Yep, I agree.
I wouldn't return it, I guess, let's put it that way.
Right.
So,
Turn it down.
so I think we had discussion, all in favor to accept this, say aye.
I
Aye.
Anybody opposed?
Aye.
Okay, motion passes. There we go. Next item, number 9, consolidation and possible action on St. Norbert College agreement for use of facilities, resources, and services.
Right. So, as part of our social connection initiative, we are planning to host a community event and in partnership with St. Norbert College Health and Wellness Services because the epidemic of loneliness and isolation, affects college students, it affects our community at large. So what a great opportunity to come together to host this community event. We're really excited about this event. It's going to allow us to engage with the community in all different sectors of the community. So we really want to get all the logistics set up so that we can start advertising for this event. Part of the logistics is this agreement. And again, any agreement that we need signed needs to go for consideration at a committee level, Board of Health, and at City Council. So because we're collaborating with Health and Wellness Services, we do not have to pay for the space, which is nice. But what we do need to fund is if we have any refreshments, any drinks and things, whether it's sparkling water or hopefully not soda, but sparkling water and things like that. So, so this is grant funded. This initiative is covered by grant money, and we're really excited to bring really an expert in social connection to our area to facilitate this community conversation. We're looking to do this in September.
I guess I never realized there was an epidemic on loneliness and isolation.
Yes.
Is that something that's recent?
Yes, actually, December of 2023, the Surgeon General announced that. So there's a whole
That's a
initiative.
focus they're working on now.
good. I'm glad to see it. So.
Yeah, and it'll be fun too, just to engage in conversations across generations is what I'm hoping for. So, bringing the older adult population to campus to engage with the college students and the middle age families, with the school systems, just wanting to really outreach and get people together to talk about this.
So this contract then also has to go through.
St. Norbert College, I'm sorry, Dennis, I don't know how to raise my hand on the phone.
Go ahead, Terry.
The St. Norbert's College has been working with ADRC on some loneliness and isolation remedies, and they've got some really cool things that their art students do with the people identified. I think most of them are people that have some form of dementia, like in the real early mild stages, and they do like an art project where they talk to the person, and then then the student interprets what they're saying and they develop some sort of artistic expression of what is done. But there are several projects that they're working on, and it's really cool if you ever had a chance to collaborate with ADRC on this. That would be great.
Yes, and they will be on our list of invitation. We do sit on some coalitions with the ADRC as it relates to social isolation and loneliness. So that reminds me, though, we should also invite the art faculty and the students at St. Norbert to make sure that they come. And because I forgot about that, Terry. That is a very good point.
Yeah.
I forgot about that.
You have to write that down now.
Well, it's good to have a little finger in a lot of pies.
Wild. Yes.
Okay, and let's have a motion, I believe, to take action to approve the St. Norbert agreement for use of their facilities to discuss the epidemic of loneliness and isolation. And if approved, it will go on to the De Pere City Council for their approval as well.
Yes.
That's my motion. Do I hear a second?
I so move.
Okay, second?
Second.
Second? Any other discussion?
I work for Family Services 9882, and they might also be interested. They do deal a lot with loneliness with vets, LGBTQ, elderly, retirees. There is definitely an epidemic, mental health crisis.
Right.
I assume we're going to address the other end of the spectrum, the adolescent who's isolated due to social media,
Yeah.
et cetera, et cetera.
Right. Yes, our school nurses, this is a topic
Yeah.
of our agenda with the school nurses. So definitely want to get them involved, outreaching to parents and teens.
So are you creating the entire day workshop? I mean, the topics and speakers and...
Yes, the abstract is created already, and the presenter has been confirmed, Dr. Carol Brees. She is a researcher in family dynamics and communication, social connection. And so the abstract has been created for the event. The agenda hasn't been finalized yet, but I'm excited. She's a very dynamic speaker.
That's awesome.
Any other discussion? Okay, all in favor of passing this along to the city council for their discussion and hopefully approval? Say aye.
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 I was waiting for Terry. Okay, aye. Okay, anybody opposed? Hearing none. You're about 5 seconds past us, delayed by us, Terry, so.
Oh, I'm sorry.
No, that's
It
okay.
happens a lot to me when I call into council. Or I miss every single vote because
Did you really?
there's
Because
a
of the
delay.
delay?
Sometimes they'll feel sorry for me and go, just let her have it.
Well, the motion passes, so
Yeah.
there we go.
You have to be really quick. Like, say it before we're even done. That's the only way to get it in. That's what I like.
And isn't it fun being made fun of over there in Madison? Okay.
Oh, I don't mind.
You don't mind, okay.
I know it's all in good taste. So.
Now comes a furniture purchase agreement. Consideration and possible action on Atmospheres, which must be the brand name of the furniture, the company you're going with. Company
Yes.
furniture purchase agreement. Will you explain that a little bit?
Sure. So again, this is an agreement that needs to be brought forward to City Council. You can see that this is being funded by the Public Health ARPA grant. Now, remember, the city the city has received ARPA funds, but this is separate from that. This is the Public Health ARPA grant, and this grant was presented by Debbie for review and approval. So that's all been taken care of. Now, because there is an agreement that goes along with the furniture purchase, I reviewed the process with Larry and the city attorney, and they think it's best that, of course, we bring it forward to committee and then council although the grant has already been approved, and it falls under the scope of work of that grant. So you'll see the amount there. We did receive the 3 quotes in accordance with the city's purchasing policy and reviewed all 3 of those quotes with the city administrator, and this has been determined as the final consideration. So the staff and I are very excited that this is an opportunity that the state, ARPA, public health ARPA funds has approved for us to be able to purchase this refresh. And so we're really excited about it.
Now, I don't know what what does ARPA stand for?
The
see that in here.
American
Rescue
Rescue
Plan Act of
Plan
2021.
Act.
Yeah. It's American Rescue.
Oh,
Plan.
American? Okay.
Okay.
Yeah, so it's
Let me-
the response after COVID.
Yeah.
Federal funds came down to the state, Wisconsin Division of Health Services
Okay.
for public health recovery, and part of that is infrastructure building and also administrative needs. So this would fall under that scope of work. And that has been approved by Wisconsin DHS as well. So I am always certain to be sure, especially with that amount, to be sure that I have approval from the grantor that they are in agreement with that purchase.
And this will provide specifically in the remodeled area.
Right. In the remodeled area, it will be new workstations for the staff as well as equipment, like furniture equipment. So for the public to come in, we can have dual use meeting rooms so that there's movable tables and lounge furniture for people who are waiting for immunization appointments. So it really allows us to modernize the department.
And this has already been approved by the city council.
The grant.
The grant has been, so we have to make a motion to have is this going back to city council again?
Yes,
Okay.
because it is an agreement that has to be signed by the mayor, it then has to move forward to city council for consideration to spend the grant that has been approved.
Okay. Do I hear a motion to, I think I've been making most of the motions. Anybody want to make a motion?
Sure. I so move.
Yes.
I'll
To second,
Yeah.
and that is to approve the Atmosphere's furniture purchase agreement
Right.
and also forward it on to the Pierce City Council for their discussion and hopefully approval as well.
Right.
Okay. Any other discussion? All in favor, say aye.
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 Okay.
Yeah.
Anybody opposed? Okay, motion passes. Thank you very much on that, Crystal.
Yeah.
Okay. Now it comes to you talking a little bit.
Talking a little bit more.
Director's report.
Yes, so this is something new. I think it's new. I'm not sure that Debbie, it's just things that don't fall within an actionable item. I thought it would be good to give high level updates on certain things that we've been working on in the department. So we talked about the students a little bit. This gives more detail. The 2 students starting in May. One student, as mentioned in a previous conversation, is a paid intern, undergraduate student. He will be working mostly with Trista, and really wanting him to focus on, community events, number one, but also tourist rooming houses and inspections of those tourist rooming houses. So people who rent out their homes that we know about need to be inspected for health and safety reasons. And so assisting Trista with that, as well as pools, doing the pool inspection, pool sampling. So samples with that. And again, outreach and his work is being covered by one of our public health grants, so his wage. And this is something that I've always wanted to do, is create this public health intern program, a formalized program. And so this is a pilot. We'll see how it goes, and hopefully we can learn during this first year and strengthen the opportunity not only for the student but for the staff, to support the staff. So we look forward to it. And our second one, as mentioned, is the Colorado State University. He's currently the Calumet County Health Officer, going for his master's degree in nursing, and lives in De Pere. So we look forward to him starting as well. And then, as mentioned, so it did come up in previous agenda items, the December 2023, there's one extra zero in there. The U.S. Surgeon General released an advisory on the impact and epidemic of loneliness. So again, that's why we're moving forward with our initiatives, not only the event as mentioned, but we did seek approval from Wisconsin DHS Maternal Child Health Grant, and we are moving forward with Definitely De Pere to do a mural project. So really using art, Terry, using art as a way to bring the community together and engage and choose the final art mural for George Street and Broadway. It's that building right by the farmers market. And we really are hoping to, like I said, engage the community on choosing the final art and open up the conversation again with that social connection component. So definitely De Pere has been a great partner with this, and again, grant money is being utilized to be able to make that happen. I also just wanted to report that with some of our public health ARPA money, we are working with the K-12 schools to fund COVID response medical equipment for future responses. So we have supplied vitals carts and otoscopes and things like that for our school nurses as they are boots on the ground delivering care, to our students. So it has been a great partnership, but wanted to let you all know that that has been happening, again, approved by Wisconsin DHS before the purchase. So we talked about the furniture already. And we had an opportunity at the beginning of April to all experience Winter Storm Cora. So during that time, we had approximately 125 people without power in the city limits of De Pere. And the health department worked with the fire department and city communications to disseminate messaging out on social media. We also did a joint press release with Brown County and Oneida about power outages and offered assistance. We of course offered the community center as a warming center and a charger station, and at the same time, knowing the limitations of that, also offered for residents to call the fire department and connect them to resources if they have needs outside of, our normal business hours. And so we didn't get a call, but it was offered. So, and then the last and final thing is we, with grant money again, were able to disseminate weather radios. Actually, and ironically, I think it was the week after the power outage during Severe Weather Awareness Week. And so, again, preparedness grant funding allowed us to purchase some of those weather radios and better prepare some of our residents who wanted to come and pick them up. They were gone by, I think, 11 a.m. That day. So that was a fast and popular item.
Oh, I bet.
How'd you advertise that?
Good.
We did it through social media, and we also did a news release.
Okay. There we go. Sorry about that.
On Fox 11.
Oh, it was on Fox 11. Yeah.
Okay.
I remember I missed the last one. I was,
That's right. You were
I was
so
1
close.
minute,
Oh,
1 minute
one away,
late.
yes.
You were so close. That's right. You did
So
come in.
close.
Guess you're just a minute behind, I guess, right?
Hey,
I have a couple.
And I think it's because, didn't you let them in the doorway first? Did you open the door for the people in front of you?
yeah,
Kindness.
And they didn't capitalize on that then, I guess. Or they did capitalize on that advantage, then, didn't they? One of the questions is, our graduate student from Colorado State or the health officer for Calumet County, how many hours a week are they going to be working here?
Right. So the first 4-week rotation is 90 hours total. So the first 4 weeks, he will be with us for 10-hour days for 9 days. And then he starts a second class, and he's still trying to understand what the expectations are for that second class. But he's so excited because this is his last hurdle to jump through before he graduates at the end of the summer.
Okay, and that's his master's degree in nursing he's working on then.
Right.
Okay. And in terms of the power outage that we had, was it scattered throughout the whole city, or was it in one specific geographic area?
Yeah, that's a really good question. I only had total numbers. I didn't have a map. WPS does have a map, but it doesn't break it down that specifically. It just showed a number for De Pere. So across the region, there were so many people that were out, but I didn't know the specific location.
Okay.
I had looked at that quite a bit on that day because we have a cottage. It was without power, but and there was a block of right off of Ridgeway
Oh, you could.
to about Charles. There's a block of homes up towards Webster that were
Okay.
out.
Oh, you could see. You could
Yeah.
drill down to the.
Yeah.
Oh,
yeah.
didn't know you could do that.
Yeah, it has a little. Well, you could click on a number. It shows how many people are affected, and it expands out.
Oh, it expands.
Then to a specific. Well, it was a very useful thing.
Yeah.
Unfortunately, hopefully we don't have to use it. too
Right,
often, but-
right. Well, good to know though. Thank you for saying that because I didn't know it was interactive,
Yeah.
that you could zoom in.
Yeah, down to the level of a house.
Okay,
House.
okay. Good to know.
That's interesting as well, yes. Thanks, Doctor, for sharing that. I was always am interested in knowing whether or not it's the lines that are above ground or the lines that are below ground
Yeah.
is where the
These were above.
outbreaks
I'm
occur.
sure it was tree related.
Any questions about it? I like this, Christo, so thank you very much for developing that as well, to put that together for us.
Yeah, it's a good update. Thank you.
Communicable disease quarterly report.
Yes, Danielle put this together. She always does such a great job. You'll see there, I mean, truly, there isn't anything out of the ordinary. We had, please note her highlighted yellow, that the numbers include probable and confirmed cases in that time range. There are still some pending investigation, especially with the coronavirus and the influenza, because it's only she has to determine if they're hospitalized. That's what we count. And there's so many reports that come in, but a lot of them, they are not hospitalized. And right now in our wastewater, actually, our coronavirus numbers are very low. But she did want to make that notation. You'll see in my memo, we also, and you probably saw on the news, that we were navigating, and I think I even emailed you all just to notify you that we were navigating the pertussis cases. And again, that was in collaboration with Brown County. So often we have residents who live outside of our jurisdiction but attend our schools. And so the exposure notice goes to the schools. And so that came from De Pere Health Department, although at first a lot of our cases were not ours in the jurisdiction of De Pere. So we navigate that with our partners at Brown County Health Department. We did also provide additional immunization clinics for those who were behind schedule or who were in need of Tdap or DTaP, depending on their age. And so we continue to investigate suspect cases. We'll likely continue to do so until school lets out, right?
It looks like it was very successful because you only had 2 cases
Yeah, so far.
here.
So far. Knock
I
on
think it
wood.
would be over by now, I would think.
Yeah, they linger still a little bit, not really connecting a lot of the cases that are coming in. And every so often, we do see this insurgence of pertussis, and we're just, it's not as bad as it was. I think it was back in 2011 or 2009, we had a lot of cases. And so luckily we're not seeing that increase, but anyway, enough to keep us in good practice. And so, so yes, thank you. And then finally, again, coordinating with Brown County Health Department in response to a case of hepatitis A. The case, again, is a situation where the person resides outside of the De Pere jurisdiction, but is employed within the jurisdiction. So we were able to respond and educated the people at the business, and then vaccinated those who were interested, and again, just an isolated situation at this time.
Has the state made any recommendations about the new COVID virus that people can receive?
Oh, the vaccine.
The vaccine.
Yeah, the only recommendation is for those who are over 65 at this point. And so we're waiting to see if any
Okay.
new recommendations come out. But that's all that's out at this point.
Okay. Okay. Any questions about the communicable disease report?
The norovirus, anything on that?
The norovirus, no, we haven't, knock on wood somewhere, we haven't heard of or navigated any outbreaks at this time. I do know that there has been some cases reported just personally and through like employment, but not navigating huge outbreaks. The nursing homes, of course, always do. They struggle with those cases, of course, when you have, people living in such close quarters. And so we do work closely with our nursing homes and assisted living, and that's the norm. But other than that, we haven't had any norovirus outbreaks at a school as of yet, as a K-12 school, or even at the college. But I have heard of cases. Interesting, though, I do believe that eventually we'll start to see norovirus testing in wastewater. They just announced in Brown County, I believe, they are testing for influenza in wastewater. So I do hope eventually that can expand, so we will have a real pulse on what that looks like for norovirus activity like we do for the coronavirus.
And I think that wastewater must be from our old sewage treatment plant to represent De Pere, and they take one for Green Bay, which is separate.
Yeah, right. And I do know that COVID-19 is tested in the city of De Pere wastewater. I don't think it's expanded to influenza. That's just at the Brown County treatment. But I do hope that one day we can see more of that expanded, because I think it just gives a better reflection and true picture on what we're seeing locally. Yeah. This is the earlier in the quarters when we see a lot more activity with norovirus.
Can they actually do testing for norovirus? They can.
Mm-hmm.
Yeah, I know some who have had it as well,
Yeah.
like a few months ago, though.
Yeah.
And, waited and then went in and said it was norovirus. However, I didn't know if they could actually test for that. Okay.
Yeah, they test your stool. It's hard, though, because it's such a quick, sudden onset, and then typically a pretty quick recovery, sometimes not. But then by the time, you get in for testing, you're feeling better. But it is detected in the stool.
Okay.
I was on a
Thank you.
cruise ship where they had norovirus, and CDC was there and shut them down for a couple hours till they got everything in place, and they had hand washing facilities and sanitizers. Everything was sticky because of the disinfectant
Yeah.
that was breaking down the varnishes all over the place. It
Oh,
was
boy.
it was a mess.
Oh,
But
Literally.
we got on about 4 hours later, and away we went.
Oh,
But it was came over from San Diego.
Mm.
Grouped in. Okay, quarterly environmental health report.
Yeah, so Trista put this together. She did a great job with that. She talked about the intern. We talked a lot about that. There are a lot of new businesses and change of owners for licensed establishments. She gave some reference for you all. There's about 230 licensed establishment by the end, or for the current licensure year, and we were at about 200 the same time last year. So she has been busy keeping up with new businesses and change of owners. They are working together, Trista and city attorney, city finance director, actually assistant city attorney, on the planning for the NFL draft. I talked about and alluded to the tourist rooming house, education for the community if they're interested in renting out their homes. There is a process for that. And so we are talking that through to plan for that in less than a year now.
Well, it's April next year, isn't it? So it'd be in our licensing year beginning July 1st.
Right, right.
Okay.
So discussions will continue. And then we had, of course, the license fee increase during the budget process. Communication will be going out with these new license renewal notices. And so it's my understanding, and Kelly can correct me, but the biggest impact is going to be for pools and rec ed camps, because I believe the state changed how they categorize those and how they license them. And so,
What is a rec ed camp?
so a rec ed camp would be like overnight camps that
Like a Y camp or a
yes,
Boy
that
Scout
stay
camp or
overnight. So
something?
typically it's at, St. Norbert College where they host,
Okay.
overnight camps for different things.
But a Y camp
can
would
you
be the
think
same
of it
kind of
Okay,
thing
the
as
same
well.
There's
sort of
another
like
one,
a,
I think that we
Oh, just one.
license.
Is it at St. Norbert?
A structured environment, basically
Yeah.
what it is.
Yes.
yeah,
Not just going in and having a campfire, but having teachers and
right.
learning process and so on.
So a special explanation letter will be going to the operators of those changes. So, and I promised a report back on the DAT CAP program review that occurred on March. I kind of alluded to that when we talked about the FDA agreement. This review did come back in compliance with all applicable state statutes. And so we do have a final virtual meeting with the state in May 22nd. And that's all in accordance with their procedures.
Okay. In terms of coordination of the NFL draft in April of next year, I know we're going to do it in the Pere. Now, is Brown County doing the same kind of thing as well? It's going to have the same message
Yes.
going out
Yes.
universally then?
Yes. Yes.
Okay.
Yes. We didn't want to be too differentiated at all. We want to stay consistent with our messaging and even how we handle, especially tourist rooming houses. But additional planning meetings will continue with, I forget, the Greater Green Bay Chamber, maybe.
Yeah,
It's
Greater Green Bay Chamber, yeah, that's what
Yeah.
it says.
Yeah, so they do a lot of the advertising and the, I believe Nick Meisner, who works with that organization, was highlighted on one of the news channels, did a really nice interview about how people go about to rent out their homes and routing them to the appropriate jurisdiction for that to happen. So I just believe that meetings are going to continue and ordinances may need to be revised. So more to come on that, but we are meeting with the city attorney and Pam with the finance department to move forward.
I'm trying to remember, are there a minimum number of days they can operate without needing a license, and then after so many days they need a license?
Yeah, actually Doug Gearing mentioned that most recently, if they're trying to get it to be a 7-day window, but I don't think they're quite there. And so
Okay.
that's why the concern is, you know, will that change? Is that going to change? We're not sure, but there is some sort of window.
I seem to remember that vaguely, I guess,
Yeah.
and
I can't.
if it's that, we probably get through the draft without having to worry about anybody, I guess. you know.
Right, right. And I'm not sure.
That's
it
there
is.
for long term,
Yeah.
so, okay. Any other questions? Tell Trista, thank you very much for putting together a nice report for that as well.
Yes.
And all 230 places have been inspected by Trista as well, then this, within the
100%.
year. Great.
A lot.
She stays busy.
And now she'll have an assistant to help her
Yes.
Right.
correct.
temporarily for a couple months, yes.
Right.
Okay, quarterly report on meetings, trainings, and education outreach.
Yes. So we attached the activity. I don't know if anyone has any questions about anything that they have seen.
No, but did you have anybody lined up for the Waldon meeting that we
No.
had? Okay.
These were all things that you've established for years. Was there anything new that's being done? I didn't really
Yeah,
see anything.
Good question. I would say in the outreach and prevention activities, something new that happened, I think it should say in here, just one second. I did go, oh yeah.
There was a norovirus outreach.
Yes,
Pam is probably interested.
we did have a little activity, so we did some education and outreach. There was an event that I participated in at St. Norbert College where I presented, it has to be in here somewhere. It's just so small I can't see it here. Let me enlarge it a little bit. Oh no. It was a presentation. Oh, Kelly, where is it here?
What was it on?
It was a presentation for the great lecture series. And so I stepped in
That's right.
because Brown County Health Officer Anna Nick was unable to present. And so I did step in and do that presentation along with one of their faculty as well as the UW GB nursing dean, and we talked about public health preparedness and the COVID response. And it was a really engaging evening. There were a lot of City of De Pere residents that were in attendance that night. I believe it was the beginning of April.
Was it this great presentations or discussions?
Oh, there it is.
Lecture series presentation.
Thank you. It's packet page 90. So I don't think that had ever been done before, and it was a really neat opportunity. Again, in the audience, I think there were maybe about 30-ish people, a lot of De Pere residents, and after the presentation, I had the opportunity to engage with them one-on-one in conversation. It was just a really neat event. So yeah, the Great Decisions lecture series, public health preparedness, and we talked a lot about COVID mostly.
We also added some DTaP and TDAP clinics
Oh yes.
in response to the outbreak.
Right.
So is this something you're going to continue with, or you were just a fill-in during that time?
That's a good question. I would be happy to be invited back, even if it was a different topic. And so we'll see. We'll see what their topics, they brainstorm them at the beginning of each year. And so we'll see if there's any applicable opportunity. But it was a really enjoyable thing.
Okay. Any other questions regarding meetings, outreach activities, and so on? Okay.
No.
Future agenda items? Nothing at all? Well, it seems like things always get added on either way, so it doesn't make any difference on that one, so. Then comes the highlight of the adjournment process. Can I have a motion?
I'll make a motion.
Have a second for adjournment?
Second.
Any discussion? Our next meeting, Kelly, is when?
That
Sorry
is
to
a
put you on
good
the spot, but I don't
question.
even know when it is.
August, second Monday in August.
Do I have it written down in here?
Okay.
Question. I do not. Let me look at my calendar quick.
I'll get it. August 12th,
12th then, okay.
Monday.
Thank
Second
you.
Monday, right? Second Monday.
Like a, yeah.
August 12th will
5:15.
be our next
Yep.
meeting then?
5:15.
Okay. Any discussion? A motion to adjourn? Second?
I'll second.
Okay. All in favor, say aye.
Aye.
Aye. Terry?
All right.
Maybe she left. Okay. Opposed? Okay.
No.
Motion is adjourned. Meeting is adjourned. Thank you.
Thank you.
Thank you.